The last type of design that we'll look at in this content is the non-equivalent group designs. And whenever you see this non-equivalent group designs, you'll just know that these groups haven't been randomly assigned, because if they have been, then we would assume that the groups are equivalent. So what we'll do is we'll describe the different types of non-equivalent group quasi-experimental design, and we'll look at these 5 types of designs. And then we'll identify the threats to internal validity associated with these designs. So what is a non-equivalent group design? A group that is comparable on the surface but not randomly assigned, such as students in one class versus students in another class, or residents in the east wing of a nursing home versus residents in the west wing. So we'll look at first these 2 pretty simple designs, post-test only non-equivalent groups. So you'll remember what post-test only is. We just do an intervention and take a measure. But now we're going to compare these across conditions, 2 groups not randomly assigned, exposed to an intervention, and then data for the dependent variable is gathered and compared. Pretest post-test non-equivalent groups occurs when 2 or more groups that are not randomly assigned provide baseline data, receive an intervention, and then provide outcome data. So here is an example of a pretest post-test non-equivalent group. So in this condition, we have an experimental group and a control group. We have a pretest occurring. All these definitions define the terms, but I'm going to talk you through it. We have a pretest given to both groups. We have a treatment given to both groups and a post-test to both groups. This looks kind of like an experiment, as we pointed out earlier, except for the nature of these groups, which we'll articulate here. So if the question is, does a reading intervention improve reading scores? The independent variable would be the reading intervention, and it would be given to the experimental group and not given to the control group. But notice who these groups are. Here we have the students in classroom A is the experimental group, and the students in classroom B, those are the control group. And what do we know about those classrooms? I mean, they might be different for a variety of reasons. So maybe I have these written down in a subsequent slide, but you can think of all the different ways that 2 classrooms could be different aside from this reading intervention. You all know what happens if there's just one child who is really having a hard time. That can impact the progress of the whole class. We know that there's differences in quality of teachers and factors like that. So there's been no random assignment, but we're doing this pretest post-test model. An interrupted time series design with non-equivalent groups is just the same, except that we add a control group, maybe 2 control groups that haven't been randomly assigned. So in this first example, we have a treatment we're measuring depression over time. So whatever the observation period, these could represent days or weeks, we don't know. And the severity of depression is measured on this 1 to 10 scale. And we can see that the treatment that has in mind, we have this group who's received the treatment. And so in this red line, we see that the baseline data, their scores around the 7 to 8 level. The treatment comes in and the scores are staying kind of high, which seems really unfortunate if someone had an idea for a treatment. In the control condition, the first control condition, we can see the depression was really pretty severe, and then it declined over time naturally. And we can see the same in the second control condition. And if it's to be non-equivalent groups, these groups were not randomly assigned. So maybe these are patients of different therapists or something like that. And in this case, we would say, wow, this treatment not only didn't help, it maybe seems to have hurt what it was trying to do. In the second example, we have once again 2 conditions. We have states as our units of analysis or our participants. So states with particular pain clinic laws in green and states without plain clinic laws. And then we're looking at deaths per 100,000 residents. We can see this blue line represents when the intervention began, when these pain clinic laws were introduced. And so we can see that in the orange line, the states without the pain clinic laws continued to have higher rates of opioid deaths. The green states that introduced these pain clinic laws around this time experienced a decline in opioid deaths. So we might say it appears that these pain clinic laws were effective. Next, we come to a pretest post-test design with switching replication, and this design is stronger than the ones that we have just been looking at. So in this design, non-equivalent groups that haven't been random assigned like these classroom groups, are given a pretest of the dependent variable right here. So their reading scores are taken, and then one group receives the reading intervention, the first classroom, and the other classroom doesn't. And then midway through the study, another measurement is taken of their reading scores. So the same reading scores are measured. So at this point, if the intervention works, we would expect this first group to have an improvement of scores not seen in the second group. Then we add the second group to the reading intervention. So now we give the second group the same intervention, and we would expect then that when we take our third measurement, that their reading scores would also increase at this time. So a similar idea to this is the pretest post-test design with treatment removal. And in this design, these non-equivalent groups are given a pretest. One group, so they're given a pretest right here. Their reading scores are taken, and then classroom A gets the reading intervention, and classroom 2 just has business as usual. Then we take another measure right here. We have a crossover, and the first classroom stops getting the reading intervention. They go back to what they had before, so the treatment is removed, and the second classroom gets the treatment. And so what we would expect to see is we would expect to see classroom 1 having improved reading scores at a higher rate than classroom 2 during phase 1, and then we would expect classroom 1 to plateau during phase 2, while classroom 2 improved its reading scores. And let's look at what these might look like. So here's an example of similar to what we've been discussing, but using math. And so if you can orient yourself to it a little bit, we have the enhanced instruction is indicated in red, so the treatment, and the typical instruction or the control condition is in green. And you can see that this first group got the treatment first. They had the math intervention, and you can see that their scores really improved. This red line. And here's where the data were taken, measurement period 2. And the second group did not get the treatment. They were the control condition. So whatever they were getting before, they continued to get. And then we took the measurement here. And we had a nice improvement in the group that had the treatment, the enhanced instruction. So at that point, the treatment was removed from the first group, and you can see their math scores dropped off. And the treatment was given to the second group, and you can see that their scores improved. And so if we look at these red lines being parallel like this and going in an upward direction, that really suggests the efficacy of this treatment. And it actually suggests also that this group suffered when the treatment was removed. Their scores did continue to plateau. They actually got worse. So having treatment and having it taken away was worse than just going with the same course of action. So this is an example of what would be an effective result with the treatment removal switching replication. So internal validity of these replicated designs, well, as indicated, these designs are stronger than the pretest post-test only designs that we've been looking at, and even the non-equivalent group pretest post-test designs because of the replication. So benefits in general, our directionality is no longer a problem. And you'll recall that when we have correlations, we couldn't tell whether variable A impacted variable B or whether the reverse was true. Secondly, replication is part of the design, and that's one of the really strong components of a good research design is that it replicates, and that's built into it. the impact of dissimilar groups is diminished because now both groups are getting the treatment, so we're having a within subject measure, and since they're both getting the treatment, we would expect to see similar gains over time. And this type of design controls for historical events, which would affect both groups in similar ways, but because one group has the treatment and the other doesn't, we'll be able to tease out the history effects. Maturation, the people in both groups would be expected to mature similarly over time. And instrumentation, we are using the same measures at repeated times, but all the people are getting the measure taken both in the treatment condition and in the control condition. There are still remaining effects, including placebo effects. So sometimes in control conditions, as you know, we do nothing to the participants who are not getting the treatment. They just go along as normal. Sometimes we do something to them that is different from the treatment that we think will work, like giving them a placebo. And in the case of a treatment, maybe we'd be giving them a different kind of reading intervention, one that we don't believe will be as effective. So in that case, the placebo effect could occur. Just the fact that they're getting something could cause a change. Secondly, we could still have experimenter expectancy effects. If you picture our school situation, where perhaps the teachers have been told about this new reading program, then the teachers who are enthusiastic about it and who get to implement it will have expectations of student progress, and those expectations alone could impact the outcomes. A teacher who is awaiting the new program to use with her students and doesn't have access to it yet might, unintentionally, but might actually expect them to not do as well because they don't have the program. So if somehow the teachers are blind to what the conditions are, then those effects would be reduced. So if they're able to somehow not know what the new program is. And finally, another kind of threat is called demand characteristics. And it just is the situation where the people being tested know what's being studied. And so all of a sudden they know that they're, say, expected to not do as well in their math class because they're not getting the treatment. And so very often when people know what's being measured, their results are no longer true and accurate. And this can happen in this sort of design. So to summarize, quasi-experimental research involves manipulation of an independent variable without random assignment. 3 quasi-experimental designs that are within subjects: the one group post-test only, the one group pretest post-test, and the interrupted time series design. And then we talked in the 3rd bullet point about quasi-experimental designs that are between subjects in nature. And some of them are both between and within subjects. And in each case, we're talking about designs that have non-equivalent groups or groups that have not been randomly assigned. The quasi-experimental research is higher in internal validity than non-experimental studies, but lower than true experiments. So it's in the middle. We saw a chart early on. And of all the quasi-experimental designs, those that include a switching replication have the highest internal validity.